Tiffany with Big Island Now here with Johnny from University of Nations. How are you?
Hey, Tiffany. So glad to be back on with you today. Thanks so much for having me on.
Yeah, no problem. So you guys just completed your widespread testing for COVID. Give us an update on where we are with that now.
Sure. Yeah, well, I think the last time I talked to you was a week ago on Monday. So that's when
Mm-hmm.
the mayor and Department of Health had requested that we get our entire campus community tested. So that began on Tuesday. We had a whole session on Tuesday. And then we had a whole nother session on Thursday. We had a total of, between the 2 days, 955 tests performed. That's staff, students, our entire staff body, our entire student body, and then a bunch of staff children all the way down to the age of 4. That was the youngest that they tested. So again, super grateful to Department of Health, to the mayor, to Premier Health, which was the contractor who did it, and then to Clinical Labs, who got all our results back to us super, super quickly.
Yeah.
So I think we got the final results back late on Saturday from that entire group of testing. And from that entire group of testing, we had 9 positive cases. Let me think. 8 of them were already in quarantine. 8 of them were known situations already in quarantine that just hadn't been tested. And then one of them was a before mentioned unknown case, but all contact traced immediately, and then everyone else in quarantine from that. So super grateful to get a snapshot of our entire community. Also, we were thankful for the results. The current positive rate of testing in Hawaii is somewhere around 2.5 right now.
Mm-hmm.
And I haven't seen the stats for today actually, but it's around 2.5. So super grateful to come in much below that. Obviously less than 1% testing positive. That was good news.
Right. So how many of these individuals who tested positive were on campus or off campus?
Yeah, it's a great question. Let me have a look to make sure I tell you correctly. But basically, I think 3 of them were off campus, and then 6 of them were on campus. So the first 3 that came back were all off campus cases. Again, 2 were already in quarantine. 1 of them was not, and we got them contact traced and into quarantine straight away. And then the 6 that came back on Saturday, they were all actually from our group of arriving students who had all been tested on arrival. 2 weeks prior. They were actually at that point 16 days into quarantine because they had the 14-day quarantine plus the additional days from the mayor. So they had not exposed anyone else. They'd all tested negative on arrival, and then obviously had been exposed in their travel somehow, and ended up later testing positive. Something that is amazing, obviously being a fairly young community, it's a university community, a lot of young people, young families, some older members in our faculty as well, but everyone who's tested positive has been pretty young, and so everyone has had really mild symptoms. We've had no one hospitalized, which is amazing. No one even having severe symptoms. So some of these, people that were in quarantine didn't even know that they had the virus. Maybe they had a stuffy nose or something like that, but ended up testing positive. So we were grateful. No additional risk from that group of people to the community. Which is really amazing. And again, that's a testimony to the swiftness of Department of Health and our medical team in-house that really just have done a stellar job to contain an outbreak that could have been much more dangerous for our, campus community and for the wider community as well, Tiffany.
Right. So how many people are currently in isolation or quarantine at this point?
As of this morning, we have 20 active cases still. So we've had a total of 52 cases. 32 of them have now been released from isolation, cleared by the Department of Health as healthy, of course, and not virulent anymore. And so we have 20 active cases left between those that are isolating at home or who are isolating in their rooms off campus at this point. So the numbers are coming down quickly, and we're really grateful for that. Again, that's just to do with contact tracing and testing. And I think even as we look ahead towards, October 15th and our island reopening to travel, I really like seeing what Mayor Kim is doing with this on-arrival testing as well. I think that's just an added layer of protection. And we've seen that in a microcosm right here, how that has worked. That's worked to quickly separate out who needs to be in quarantine,
Yeah.
allowed contact tracing to happen, allowed the spread to be controlled and
Hmm.
to not go large or go out into the wider community. And I think it's encouraging to see that right as we're getting ready to open up the island, to a much wider group of people coming in.
Right. Right. Um, so what's the university's plan as far as the service projects and service to the community? I mean, are you guys going to put push pause on that for
Yeah,
now? I mean, because you don't want another cluster happening, and at
right,
the worst, you don't want to infect the community, right?
right. Yeah, I mean, it's a great question, Tiffany. I think we're definitely looking closely at everything. We have had real strong safety protocols. We've been champions of masks, social distancing, all the sanitization methods since the beginning of this thing, which is part of why, as a large community, we had no cases this
Hmm.
entire time. However, I think it definitely bears looking at again. We're also looking at how do we increase our communication to our community about all those measures so that we are continuing to remind everyone of the importance of those measures. And it's of course, it's not just about whether or not we get sick or I get sick. It's about who do we spread the disease to before we know that we are sick, right? That's part of the
Right.
thing that makes COVID so interesting, is you can be not sick or barely sick and actually spreading the virus to other people. So we're looking at our internal procedures to go, how do we communicate better with our staff and students to make sure they're all aware of the importance of this, so that we can move forward with confidence with the things that God has called us to do. Like I shared with you last week, the pandemic season is a season where many families, children, individuals in our community have faced real difficulties,
Yeah.
with whether it's employment or housing or school. I mean, all my children are off school. They're doing Zoom school at home. That's
Hmm.
challenging. That's challenging for employment. It makes all these challenges. And we want to continue to serve our community. We have to. Our community needs care and love and help, but we have
Hmm.
to do it in a way that's safe, both for our staff and students and for the people that we're ministering to.
Right. Right. Just to jump back really quick, how many new students came to the campus, and how many of those new students tested positive for COVID?
Yeah, it's a great question. So we had just over 300 students arrive on September 24th, and they came in primarily from the continental United States.
Hmm.
Again, we had worked out with Department of Health a very rigorous protocol of testing that's similar to what Mayor Kim is putting in place for the island. That was where they get a rapid test on arrival. That means that within 15 minutes, you have, with a high degree of accuracy, not perfect, but a high degree of accuracy, you can see is someone virulent or not, and then followed that up with PCR testing, of course. And then that singled out 4 people on arrival day, September 24th, that we were able to contact trace, put a group into isolation from that group. Okay. And so those 4 were initial. And then, like I told you, there was a group of 6 in our mass testing that were exposed, that had been in quarantine for those 14 days, had not tested positive on arrival, but subsequently, when we tested them, we actually tested them on day 14 of their quarantine, and they tested positive. So they continued in quarantine now, and they're actually, they're in quarantine from now. So I would just ask, especially for those students, prayers for them would be amazing. These are people who have hearts to serve. They love God, they love people, they're here to be
Hmm.
trained, and they're looking at, something like 4 weeks in quarantine. It's definitely a rough introduction to our island, but
Yeah.
they're committed to it. They're committed to the safety of this island. They get it. They understand, as are we. So all that to say, it's a total of 10 in our student body that ended up testing positive. If you look at the statistics on that, that's about what we're seeing from across the United States anyway, out of 300.
Hmm.
And yeah, thankfully, again, all of them healthy, recovering well, minor symptoms, no one hospitalized.
Any young children? I know that you
No,
said.
no young children,
Okay.
only adults. Only adults tested positive in the student body, and we're grateful for that as well. We did have some families that arrived. I'm not sure if I shared this with you last week, but some families arrived actually 2 or 3 days before. So all told, they were in quarantine for something like 20 days before the mayor released anyone who was negative to
Right.
come out of quarantine.
Okay.
So for mothers and dads with little kids in a dorm room, that was a long time.
Yeah.
And again, I want to give massive props to all of our students who took the news, with a lot of grace and just said, okay, if that's what the mayor needs, if that's what the Department of Health needs, then we're going to do that. So the mayor gave us release on Saturday for anyone who had tested negative to come out of quarantine, which is amazing. We're still eagerly awaiting an official statement from the mayor that would kind of clear our cluster as not being a threat to the wider population anymore.
Mm-hmm.
But we're hoping to get that today or shortly if possible.
Okay. Yeah. Yeah. Well, that sounds great. Yeah.
Yeah, awesome. I would just say, if I could add one thing, we really do continue to be committed to the safety of our Kona community. You guys as a community are our friends and neighbors. I've been a Big Island resident here for 14 years. I've had 3 children born here. This is our home.
Mm-hmm.
And we want to be a blessing to this place as our home. What I would say is if anyone out there has any concerns at all, we'd be happy to take queries, questions, info, phone calls from them. They can actually write to an email address, which is community@uofnkona.edu. That's community@uofnkona.edu. And we are responding to every single query in person. We want people to know what is happening. We want people to feel comfortable and confident. We want people to have their questions answered. So I want people to know there's a place for that and they can be personally responded to. It's so important to us that this community feels safe and feels like we can run forward with confidence.
A couple things before I let you go. Are you guys going to be doing any like follow-up testing?
I think at this point where we're at is we're back to kind of the standard Department of Health protocol, which is where if you are symptomatic or if you were exposed, if you're knowingly exposed, then you're of course immediately into quarantine and tested. If you are symptomatic, then you go to your local urgent care or to a testing center and you get tested. That's where we're back to right now. Again, we're so thankful to Mayor Kim and Department of Health for their willingness to test our entire community. But it was a massive logistical operation to get that done. And again, massive props to clinical labs for working to get our results back so fast, but there is a testing capacity. And so we don't want to flood that capacity. We just want to test the people that need to be tested. So we're back to full alignment with Department of Health, great communication with them. As they see fit for anyone to be tested, they will, as well as anyone who's symptomatic.